Today we will discuss infectious bursal disease. All of you know about the IBD, infectious bursal disease. It is also known as Gumboro disease, infectious bursitis, infectious avian nephrosis. These are its common names. So whenever anyone asks you about there is Gumboro, it means it's IBD. If he says that it's infectious bursitis, it's again IBD. And if someone discuss about infectious avian nephrosis, it's again the IBD. So these are the common names of IBD virus disease. Sorry. It's acute and highly contagious disease of chicken as well as turkey. But we will discuss the chicken which we are raising at the moment, and its target cells of IBD virus is B lymphocytes. And then the bursa and lymphoid organs are severely affected because the B lymphocytes are produced in the bursa. That is why they will affect the bursa and lymphoid organs. So economically significant because heavy mortality in 3 to 6 weeks of age and severe prolonged immune suppression of chicken infected at early age. So morbidity, or we can say the sickness range from 10% to 100%. While mortality in normal cases it goes up to 20%, while in very virulent infectious bursal disease virus it goes up to 100%. Etiology: what is the cause of infectious bursal disease? It's basically a viral problem which is caused by Birna virus, which is a double-strand DNA virus. It has two serotypes: serotype 1 IBD virus, serotype 2 IBD virus. IBD virus 1 variation in virulence from apathogenic to highly virulent strains. IBDV2 serotype is non-pathogenic or immunosuppressive. So virus is very stable and can survive up to many months in the environment. Transmission: how it transmits to the other birds. The main transmission is through orophycal route. Orophycal means through drinking water, feces, feed, everything. Oro means mouth opening, and fecal means vent. That is why we say that if a bird is infected, he can shed the disease through his vent, through his feces, and there might be chances of respiratory issues. Affected birds may excrete virus for 10 to 14 days in the feces. Once a bird is infected, it will shed the virus up to 14 days, mean 2 weeks in his feces. So it will be a carrier for 2 weeks, and it will infect the other sites as well. So about the mechanical transmission, it can move through human, wild birds, and insect from one place to another place. And the sites which are infected, they can remain up to many months, like up to 3 months they can remain infected. Once a site is infected, it can remain infected for 122 days. Mean we need to take strict measures to control this problem. And there is no vertical transmission, like it will not transmit through eggs or through offspring. Now we will discuss about the pathogenesis, how it do the pathogenic, how it cause infection. After ingestion, the virus multiplies in macrophages of the small intestine, which is duodenum, jejunum, and cecum. From there, it moves to the liver, the Kupffer cells. From Kupffer cells, it comes into the blood circulation, and through blood circulation, it reaches to bursa and multiply with the B lymphocytes. After multiplication, it causes severe massive viremia and finally destroys the lymphoid follicles in the bursa of fabricius as well as the circulating B cells in the secondary lymphoid tissues, such as gut-associated lymphoid tissues, called conjunctiva associated lymphoid tissue, Balt bronchial associated lymphoid tissue, cecal tonsils, Harderian gland, etc. So, clinical signs. If we talk about the clinical signs, clinical signs may vary with an age, breed, or virulence of virus. Its incubation period is only 2 to 3 days. Mean if disease occur, the bird get infected on Monday, it will show signs and symptoms on the second day or on third day, which is Wednesday, Tuesday or Wednesday. So it's a short incubation period. It can, as the bird infected, it will start showing signs. The initial signs which we can observe in the sheds are depression. Bird will be depressed, white, watery diarrhea, soiled vent, anorexia, ruffled feather, reluctant to move. Can anyone tell me what is anorexia? It's basically birds stop eating, loss of appetite. And soil vent mean when the bird will do watery diarrhea, when it will sit on the ground, its feathers will be soiled. So the bird will not move. It will just sit down like a coward. We can see in the picture. We can see here the bird is sitting down his head, another hair. Most of the birds you can see dull and depressed. They are not going to feed anything. They are just sitting at one space place. And ruffled feather, you can see the feathers which normally in the active birds they are smooth, but here you can see it's ruffled like to and fro. And whitey diarrhea we can see here, the diarrhea, and sometimes it's too heavy that there is a vent pasting. Now we will discuss about the postmortem signs, the clinical signs which we can observe before opening the dead bird. Now we will discuss about postmortem signs. In the postmortem signs, there will be dehydration of carcass. When we will open the bird organs or bird carcass will be dehydrated. Second, hemorrhages on pectoral leg muscles are the typical signs of IBD. We will see the pictures in upcoming slides. Hemorrhages at the junction of proventriculus and gizzard. Then intestine with excess mucus, liver, hepatomegaly, and peripheral infarcts. What is hepatomegaly or hepatomegaly? It's basically enlargement of liver. Same is spleen, splenomegaly, kidneys swelling and white appearance, dilatation of tubules with urates, cell debris, and swollen bursa. Now, if we discuss about the hemorrhages on the pectoral muscles or legs, you can see here there are severe hemorrhages on the thigh. You can see there. While if we see the hemorrhages on the junction of proventriculus and gizzard. You can see it here. This is the portion. While sometimes people confuse it with Newcastle disease. In Newcastle disease, the hemorrhages will be not there. They will be present on this side. You can see affected liver, but it's hepatomegaly, mean enlarged liver. Second, infarctions. You can see splenomegaly. It's only 3-week-old birds, and in 3-week-old birds, the spleen is normally less than 1 centimeter. But you can see here it's more than 1.5 centimeter. In chicken, if you talk about the chicken spleen, it normally grows faster because they're getting extra feed and their development stage is quick as compared to layer and breeder. Now, if we talk about the kidneys, you can see here the kidneys are swollen and uriates are accumulated in all the kidneys. It's heavily swollen kidneys. Another picture of kidneys you can see here. These are swollen kidneys. Here is the bursa. This is the main part where virus will target the B cells which are produced in the bursa. So when the disease will affect, the main portion will be bursa. We will it's another swollen, and we can differentiate between vaccinated birds with challenge condition and non-vaccinated birds with challenge condition. We can see here the hemorrhages on the bursa. These are the folds of bursa, which are normally present in the bursa. They are flower-like projection. When we open it, it's like a flower. But when problem occurs, you can see the hemorrhages are sometimes it's more severe. You can see blood everywhere. Yes, Nidhi, you want to ask any question? Here we can see it. These are the pictures of two different bursas, in which one bursa is only hemorrhages on the folds, while on the other side, the second bursa you can see it's full of blood. It's severely damaged. So in very virulent infectious bursal disease virus, this type of bursa we can see. It mostly occurs in non-vaccinated birds. Like we vaccinate the bird and disease occurs, we will not see this type of infection. We will see like hemorrhages if there is an infection in the vaccinated flock. Diagnosis. How we can diagnose that this is the IBD virus or Gumboro virus problem? On the basis of history, either it was vaccinated or not. Second, the shed was previous flocks of this shed was affected or not. Then clinical signs, we are seeing the signs of the birds. Then the postmortem lesions, which are almost pathognomic lesions, or we can say it, they will confirm. But the main confirmation is through serological tests like ELISA. Differential diagnosis. How we will differentiate it from other disease? Coccidiosis. In coccidiosis, cecal tonsils are full of blood most of the time. While if it's other strains of coccidiosis, then there will be hemorrhages on the in the intestine, but bursa will not affect. Newcastle disease, already discussed that in Newcastle disease, the hemorrhages will be on the glands of the proventriculus, not on the junction of proventriculus and gizzard. Hemorrhagic syndrome of muscles and other hemorrhages, water deprivation with swollen kidneys, like if we see dehydration, then it will affect only limited organs. It will not affect like bursa, or there will be no hemorrhages on the thigh or pectoral muscles. And excess renal urates. These are the diagnosis. Treatment. For viral outbreak, there is no treatment. We can give only supportive therapy to boost up their immunity. So for supportive therapy, we can use multivitamins or spray of disinfection on the birds and around the shed to minimize the problem or to reduce the lifespan of the infection. But it will take the ones the bird which are infected, they will shed virus for 14 days, 10 to 14 days. So we need to be careful about this. How to control it? How we can control the IBD problem? The first step is biosecurity measures. If our biosecurity measures are proper, there are least chances of any viral outbreak. Not only IBD, any other viral outbreak, if our biosecurity measures are proper. Second is shed cleaning and disinfection properly, like we are using proper chemicals to disinfect the shed, to clean the shed. Then we already discussed about that insects are also a carrier. We need insecticides also to properly clean the shed from like beetles or any other insects. Spray of disinfectant into and around the sheds. And one practice which we have observed, if we spray disinfection on 7-day-old bird, it minimizes any, either it's bacterial or viral outbreak, it minimizes the chances of problem. So whenever your birds are 7 days old, especially in layer and breeder, so you should spray so the if there will be any outbreak, upcoming outbreak or any virus infection, it will be minimized at that time. Then proper disposal of mortalities. The affected birds which are died from this problem, they should be disposed of properly. Not like we are just packing them and in the bags and putting it out the shed. It's causing the problem to the other sheds. So when the birds are died from this problem, just bag it and dispose it simultaneously. That's all. Thank you very much. If you have any questions, you can ask me.